All right, everyone. I want to first and foremost welcome you guys back to another video. Um, Today's video, or tonight's video, when I post this, it will be nighttime. Tonight's video is going to be under the title of what is the difference between sickle cell trait and sickle cell disease. Now, that's a very broad topic, so we're going to cover a lot. I'm going to give you some very educational information. I'm going to also provide resources of where I was able to gather all my information, as long as information of my own personal life experiences with knowing the difference between sickle cell trait and sickle cell disease, right? So first and foremost, I just want to start by saying that millions of people worldwide are affected by the sickle cell blood disorder. About 100,000 people in the U.S. have sickle cell disease. It mostly affects African Americans, but it can also affect people from Hispanic, Southern European, Middle Eastern, and Asian Indian backgrounds. Another 2.5 million people in the U.S. have sickle cell trait. But having sickle cell trait is not the same as having sickle cell disease. And I'm going to clarify that for you guys. What is the difference between having sickle cell trait and sickle cell disease? Well, let's start with sickle cell disease, right? So people with sickle cell disease have red blood cells that are crescent-like or shaped like a sickle, right? So hence the name sickle cell disease, because the cells are shaped like a sickle. From my personal experience, I've always liked to have called it to be like half a moon. If you ever looked at a moon when it's only half a moon, that's exactly what a sickle cell looks like, right? This abnormal shape makes it difficult for the cells to travel through the blood vessels. As the sickle cells clog the blood vessels, they can block blood flow to various parts of the body, causing painful episodes, known as sickle cell crisis, and raise the risk of infection. In addition, sickle cells die earlier than healthy cells, causing a constant shortage of red blood cells, also known as anemia. Sickle cell disease is diagnosed by a blood test. There are many forms of sickle cell disease, including sickle cell anemia, which is the most common and also the most severe. With all forms of sickle cell disease, symptoms can vary and severity from one person to another, but include serious pain, fatigue, shortness of breath, and dizziness. People with sickle cell disease are at a higher risk for health complications, such as infections, stroke, eye damage, and acute chest syndrome, a condition that causes chest pain and trouble breathing, fever, and coughing. It's important that people with the condition work with their healthcare provider to manage their symptoms, right? Currently, there is no widely available cure for sickle cell disease, right? That right now, from my experience, there's no cure worldwide. The only cure that I am aware of is called a bone marrow transplant, and I'm gonna go deeper into what a bone marrow transplant is on a future video, hopefully soon. But yeah, that is the only form of curing or getting rid of sickle cell disease in a patient, or in, a patient's child, or a parent, or adult, young adult, a child, a newborn. That would be the only way. But sickle cell research efforts are underway, including pain management and gene therapy, right? In late 2019, 2 new treatments were approved by the FDA to treat the condition, right? And again, that is going to be, those treatments, I'm going to go into detail on what they are on another video. so that I can provide you with that information, right? So, sickle cell trait. When someone has sickle cell trait, it means they have inherited one sickle cell gene and one abnormal gene, right? People with sickle cell trait have both normal red blood cells and some sickle shape red blood cells. Most people with sickle cell disease do not have any symptoms of sickle. Most people with sickle cell trait, most people with sickle cell trait do not have any symptoms of sickle cell disease, correct? As carriers of the sickle cell gene, though, parents have a 50% chance of passing the gene on to their children. That means people with sickle cell trait can be at risk of having a child with sickle cell trait or sickle cell disease, right? In the US, all newborns are now screened for sickle cell before leaving the hospital. And I want to make a pause there because I was born in the Dominican Republic. That is a third world country. The healthcare system is not the best at all. And their medical technology is nowhere near as advanced as it is here in the United States. So with that being said, I believe wholeheartedly that if I were to have been born in the United States or anywhere in the United States, and that test was administered to me, there would have been a lot more preventative measures to make sure that my sickle cell disease didn't get as bad as it did. So yeah, they do that now for children and all newborns in hospitals before they are discharged and sent home, right? If a child is diagnosed with sickle cell trait or sickle cell disease, his or her parents may wish to see a genetic counselor, right? Genetic counselors can help parents better understand what it means to be a carrier of the gene and what chances of having a child with either sickle cell disease or sickle cell trait are. People with sickle cell trait carry only one copy of the altered hemoglobin gene and rarely have any clinical symptoms related to the disease. In contrast, people with sickle cell disease carry two copies of the altered hemoglobin gene, right? With two copies of the altered gene, the red blood cells are destroyed rapidly, and patients have chronic severe anemia or low hemoglobin levels. Though less common people with sickle cell trait can still have symptoms of the disease, several of the risks to persons with sickle cell trait occur when they engage in highly intensity physical activity or are active at higher elevations, such as mountains or unpressurized airplanes. Persons with sickle cell trait occasionally experience damage to their kidneys from sickling in the sections of the kidney. The disease name has evolved from the sickle cell shape of red blood cells, which makes them stick to the walls of the blood vessel, in turn reducing blood flow and oxygen supply to organs. This can cause severe, often crippling pain. The lifespan of sickle cell disease patients is on average 30 years less than their normal counterparts. Now, before I go any further, I want to speak a little bit on what I just said, specifically where it stated the lifespan of sickle cell disease patients is on average 30 years less than their normal counterparts. So, back in the early to late 80s and 90s, sickle cell disease, or anyone that had sickle cell disease, was known not to live past the age of 30 because of how severe this disease is. But now in the 21st century that we are currently living on, I can say from personal experiences that that has changed. And the way that that has changed is, as long as you are able to maintain a healthy lifestyle, maintain all your doctor's appointments, maintain a consistent schedule of taking all your medications accordingly, you'll have a healthier life and you'll have a longer lifespan. And I can attest to this because I currently, right now, am 33 years of age, meaning that I have lasted 3 years more than the average lifespan, right? So just make sure if you know anyone, or if you are someone that has sickle cell disease, or if you just want for your own personal educational reasons, make sure that if someone comes to you and asks you what is the lifespan of someone with sickle cell disease, and if they tell you that they read that they only live up until the age of 30, you let them know what I just stated, right? Moving on, I want to go through some of the references that I used for this video, right? I'm going to go through just 3 of them. So the first reference is the American Society of Hematology for Patients Sickle Cell Disease, assessed December 11, 2019, right? The second resource is Cleveland Clinic's Sickle Cell Anemia and Sickle Cell Trait, assessed in December 11, 2019, right? All of these were in 2019. And the third and final one is Centers for Disease Control and Prevention, Sickle Cell Disease. And it was published and edited December 11, 2019. And with that, I'm going to leave you guys. I hope that you enjoyed this video. I will be coming back with more videos more often. Have a great day and see you next time.